A final hug with Mi Amor. Like most ICU physicians, I've witnessed my share of death and tragedy, both pre- and post-pandemic. Despite that, watching a long-term outpatient succumb to their illness, this is what always hits me the hardest. It feels like such a profound loss, and in my younger days, my rational mind could never understand it. They aren't family or a close friend, so why does it hurt so much? My name is Tisha Wang. I'm an ICU physician at UCLA Health, and over the past few months, I've been writing about my experiences during the pandemic. You know, I grew up in this tiny town in Texas, and we just didn't really fit in. We were like the only Asian family. You know, I kept a journal, I kept a diary, it was my outlet. Part of my life is actually documented in letters to other people, and funny enough, my best friend to this day was the pen pal I met when I was 13 years old at summer camp. What I love most about writing is how therapeutic it is for me. It helps me just process through things, it helps me figure things out. I also try to focus when I'm writing on positive things, and so it does help me write about gratitude even though I'm having a bad day or just, you know, had a really bad situation in the ICU. And I've always found it as a healthy way of dealing with my emotions. I've been doing this now for 12 years, and I will say every ICU stint feels a little bit different. You know, it's hard to deal with COVID. The surges keep happening over and over again. These patients couldn't have family members there. They were often, you know, dying alone, and that was something that made all of us incredibly sad. One of my trainees wrote me in the middle of the night, "I've lost a piece of my soul during the COVID pandemic in watching these patients die. Is that something I'm ever going to get back?" But somehow, underneath her frail body, rapid breathing, silver hair, and masked, tired-appearing face, I could still see her bright and slightly mischievous eyes. Her lungs were clearly struggling, and now her heart was failing, and there was little else to do. I lingered for a bit, not wanting the appointment to end. When the time came, I couldn't even give her a final hug goodbye because of the ongoing fear of COVID. Instead, we sat there with our masked faces blowing endless kisses to each other as I told her over and over again in my broken Spanish that she was Mi Amor. COVID-19 has undoubtedly changed every single relationship in every one of our lives. We often can't even hug or kiss our own friends and families. But the way it's ruined people's ability to say a final goodbye to those they love is one of the greatest tragedies in this pandemic. No one will ever get these lost moments back. I'm grateful that I at least got to see my dear patient in person one last time, but what I wouldn't give for a final hug with Mi Amor. Her daughter texted me and said, you know, "I want you to know that she really considered you her amor." And it just brought everything out. I basically just locked myself in my room and just started writing because it just seemed like the only thing that would make me feel better at the moment.